Heather's breast cancer is now incurable because it has spread to her bones. She takes a drug to help strengthen her skeleton called bisphosphonate. Now scientists have discovered bisphosphonates aren't just useful for advanced cancer, they can actually stop the disease spreading in the first place.
If the drug had been available when I was diagnosed with my primary breast cancer, I would have taken it with both hands. If it can prevent women from getting into the situation that I'm in, where I have cancer in my hips and my pelvis and my back, it's a no-brainer. You'd take it.
The research found when bisphosphonates were given to women whose breast cancer hadn't yet spread, the drugs prevented cancer developing in their bones. Their risk of dying was 18% lower over a decade, meaning the use of bisphosphonates could save more than 1,000 lives each year.
The research today shows probably one of the most important steps forward for breast cancer research in the last 10 years. So these bisphosphonate drugs can be helpful for women with primary breast cancer to stop the spread of breast cancer, which is what causes the deaths of so many women in this country.
But there's a problem. Bisphosphonates are only licensed to treat the brittle bone condition, osteoporosis, and those who already have bone tumours. And their patent has run out, so they're cheap, just 5p a dose, but that also means there's no incentive for drug firms to apply for a new licence.
And that's always a bit of a hurdle for doctors prescribing outside the approved licence for a drug. So we need some guidance and advice from either NHS England or NICE or some national body to say this is a reasonable thing to do, and then I think we could start.
Bisphosphonates can only help stabilise Heather's condition, but for thousands of women whose disease hasn't spread, they could be a lifesaver if the bodies who draw up guidance for doctors can be persuaded to widen their use.